On Health Matters Television for Life, the growing popularity of complementary and alternative medicine.
This was my last resort.
A college student finds relief from chronic pain in a whole new way.
It's insane being able to go through the day and not having my back hurt anymore.
See the therapy that got her up and running again and how non-traditional approaches are working side by side with standard medical care. Right now on Health Matters.
Health Matters is made possible by viewers like you, the friends of KSPS, and by the following.
As the saying goes, children aren't just short adults. They have special needs. I'm Dr. Judy Felgenhauer. I chose Providence because they see the need for specialized care just for children.
Find your doctor online at phc.org.
Providence has the best professional and the best nursing staff, without which we could not do these complex procedures. I'm Dr. Stephen Nisko, and I choose Providence because Providence is fully invested in my success and in the success of my patients.
Washington State University Spokane, studying the feasibility of a state-funded medical school on the WSU Spokane Health Sciences campus. More at medicine.wsu.edu.
Good evening and welcome to Health Matters here on KSPS. I'm your host, Teresa Lukens. We are a nation of what is new and different. We crave it. The same can be true when it comes to treating what ails us. Enter the growing popularity of complementary and alternative medicine. So tonight we are going to go beyond the typical doctor's visit in search of alternative cures, from age-old practices to cutting-edge therapies, plus the role faith has in healing. Here tonight, a distinguished panel ready to answer your questions. Dr. Monica German is board certified in both pediatrics and integrative and holistic medicine. She works at Medicine Naturally. Pamela Langenderfer is a doctor of naturopathic medicine. She works at LAKESIDE Holistic Health. Jane Mather is the director of the Providence Center for Health and Well-Being. And I want to welcome all of you tonight. This is a wonderful topic and one I've been excited to explore for quite some time. First of all, I'd like to go around the panel and just talk about what you do at your practices and sort of how it fits in tonight's topic. Dr. Langenderfer?
I'm a naturopathic physician and a licensed acupuncturist, and I do a lot of different things, but have a focus on women's health and do a lot with hormone therapy, fertility, and different issues that arise at different times in life for women.
So what is your training and background?
I did my doctorate of naturopathic medicine at the National College of Natural Medicine in Portland, Oregon, and I also received my master's in Oriental medicine from there as well.
Okay, and Dr. German?
I'm a medical doctor. I'm also board certified in pediatrics. I'm board certified in integrative medicine and holistic medicine, and I'm a certified functional medicine practitioner.
All right, so you work with both children and adults at your practice?
That's correct, yes.
All right, and we'll get more into that in just a moment. And Jane, talk about what goes on at the Center for Health and Well-Being.
Well, it was formerly the Center for Faith and Healing, and so the faith piece comes in. But we do a lot of planning for helping patients, families, practitioners of medicine, nurses, and the community at large understand the intersection between what we believe and how we heal.
And how the body and mind come together to make that happen.
Mind, body, and spirit work together. You can't impact one without impacting the other. And so our part is to help boost, because there's a lot more attention to mind and body in our culture. Our hope is to help understand how to support the spirit as well in the healing process.
So you have a lot of education classes and things like that going on?
We do. We had more at one time, and we're going to have lots more going forward.
Okay, we can talk more about that also. Also tonight, we do welcome your phone calls and your emails. This is an excellent opportunity to take advantage of this distinguished panel, as we mentioned, here in our studio tonight on alternative and complementary medicine. I think one of the things, Dr. Langenderfer, that I'm most curious about is the difference between holistic and naturopathic. What is the difference, or is there one?
Well, naturopathic medicine has deep roots in looking at the body as a whole. And naturopathic physicians really focus on trying to find the underlying cause of disease, and traditionally have used natural methods to do that, such as herbs, homeopathic remedies, and nutrition. So that's been primarily the focus, and so I guess you could say that holistic medicine is a part of naturopathic medicine, and naturopathic medicine is a part of holistic medicine, so they kind of go hand in hand.
Do people often get confused about that, Dr. German?
They do. I think a lot of people don't understand what functional medicine is. I am very excited to have the opportunity to be trained in functional medicine. I think functional medicine is the medicine of future that's available right now. It seeks to understand and address the root cause of disease, and also looks at the system, at the body as an integrated system. Doesn't treat just one part of the body, it treats the whole body, looking again at the interaction between body, mind, and spirit.
As a medical doctor, how was it you got into this field and added this onto your practice, and the interest to this type of healing came about? How did that happen?
A few years ago, my son had recurrent sinus infections, recurrent ear infections. He was very picky, he wasn't eating right. And I realized that I wasn't able to help him. We did the antibiotics. He was getting better, but then he was getting worse again after 3-4 weeks. So we went into this pattern of infection, antibiotic, improving, and getting worse. And then I realized that I had to look into different modalities, and I was very happy to be able to find functional medicine and homeopathy. He was in the hospital when he was 2 years old with asthma on oxygen for 3 days. He's almost 10 years old now. He's not on any medications. We worked with his diet, some basic supplements like vitamin D, omega-3s, probiotics, and homeopathy and herbal supplements, and he's been thriving since then.
It's so interesting. And what type of patients do you see? Obviously, when you see children, probably a lot of food allergies come into play, and asthma, things like that. Is that typically what you're seeing children for?
Children can have a variety of problems. A lot of times they start with digestive issues. So we see colic when they are little, constipation, reflux, and then eczema, asthma, allergic rhinitis, chronic recurrent otitis, ear infections, sinus infections. And then as they get older, abdominal pain. A lot of kids have what's called chronic or functional abdominal pain. That means that there is no clear medical reason for their pain, but they're still suffering. Functional medicine can offer a lot of help to these kids.
And typically, what are your patients then coming in for? You know, are they sort of at their wits' end by the time they see you in some cases?
You know, that happens to me quite a bit, actually, is that a lot of times I am somebody's last resort, and they've sort of been through the gamut, and they're not sure where else to turn. And then they come in and seek me out looking for a different perspective. And I have a wide variety of patients, and all ages come in. And a lot of times, as Dr. German was talking about, just looking at diet is really the foundation for a lot, I think, what I do, and just with natural medicine in general. And what I try to do is to get people to look at food in this whole different way, that this is your medicine, and you have to think of it as your medicine. So every time whatever you choose to eat, you have to think about how that's going to impact your body.
What kind of transformations have you seen typically when it comes to changing people's diets?
Huge transformations. And one thing that I try to emphasize to patients is that, you know, I can give you all the supplements in the world, but if you don't change your diet, I'll only get you 50% better. And that really has to be the foundation. We have to build that strong foundation and go from there. And sometimes simple diet changes is all they need. Sometimes it's more than that, and we have to add other things in.
And Jane, that can also bring in then behavior, changing behaviors, how we think about not only food, but the way we're living our lives, and that's where the center can come in.
Absolutely. I think in traditional medicine, more than in holistic and naturopathic medicine, we've focused more on waiting until people are sick to treat them. I like the idea of being able to go out and teach, what does it mean to you to be healthy? Because for different people, that has a different feel to it. It has a different sound to it. And we haven't taught or trained our nation to think about what it means to be healthy in a holistic way. Diet and exercise are certainly high on everyone's list, but not always practiced, especially if they know that they should do better. So changing the behavior and the mindset, changing the motivation for people is also important. You know, you talked about being kind of the last resort. I think I'm trained as a certified chaplain. I think we're the last resort.
That could be the case.
People don't call us until they've exhausted every other possibility. Mm-hmm. But we'd like to be able to say, what are you doing to have a healthy spirit before you are sick? Mm-hmm. How do you keep your spirit healthy? How do you keep your attitude healthy? How do you make healthy choices for lifestyle? So that's part of what we hope to accomplish.
And some of that can mean your faith. It can
Absolutely.
mean meditation or yoga or any other form of exercise. Is that correct?
Absolutely. Most people know who are heavy into exercise that you hit a certain rhythm and the endorphins and your whole being changes because of it. And could we do that in other ways? Nurses are busy at the bedside. They can't go out running even between, you know, on their 15-minute break. They can't come back all sweaty. Mm-hmm. So how do we help find that relief, that sense of calm and peace on the job?
Mm-hmm. In the few moments we may have to do that.
Or in the midst of the crisis, because that may be the most important time to find peace. So we're looking at ways of bringing that to the staff, to the public. Mindfulness is huge. Big reviews in Time magazine recently and the Harvard Business Review. Mindfulness is one of those ways, and it's a spiritual practice. So can we teach people to enjoy and use that practice for their well-being? Absolutely. And it isn't expensive. Doesn't even need a prescription, although I wish all doctors would write a prescription for people to be mindful.
That would be excellent. We already have some calls coming in, ladies, so let's get to the phones. Richard from Clarkston, Washington. Good evening, Richard.
Good evening. I'm a retired ophthalmologist and also board certified in anti-aging medicine, and I'm not seeing patients now, but I'm so happy that this kind of comment or program is being on the air and people talking about it and just bringing this to people's awareness. It's a great program, and I'm glad you're putting it on.
Thank you very much. Did you want to ask the panel a question this evening?
No, I just want to thank you for putting it on.
Well, we sure appreciate that. Thank you so much, Richard. And you know, an excellent point. We're all talking about it. It's coming more into play. The internet, social media has probably played a role in us learning more about holistic medicine and natural methods. You also do acupuncture, Chinese method. Talk about how you treat patients with acupuncture, because it was my understanding that most people seek out an acupuncturist for pain, but that's not necessarily the case.
Right. When people hear the word acupuncture, they do traditionally think about, oh, only for back pain or chronic pain issues, but actually it's used for lots of different things. You can use it for hormonal problems, and I actually use it quite a bit for fertility issues, digestive issues, post-traumatic stress. And one of the things that's been really great to see is that the military has started to implement acupuncturists as well at the military bases to help with the chronic pain and post-traumatic stress issues. So we're seeing it become more and more available to people, and as people become more aware of it, then they start to understand how acupuncture is really just another modality that can help many different things.
How does it work?
That is the question I think that everyone always wants to know, exactly how does it work? And I think one of the great things is that now that we have modern medicine, we're able to see through MRI machines that when you stimulate different points, different parts of the brain become more active, different hormones get released. And so now we have a measurable way to see that there is something happening in the body when people do receive acupuncture.
So interesting. I'm fascinated by it. And it's thousands of years old.
Yes.
It's a practice that goes back, you practice the Chinese method.
Yeah, it goes back about 4,000 years and has been used for a long time. And I always think something, you know, something has to be working if it stayed around that long a time, because I can't imagine that people would continue to do that, you know, if they weren't seeing any benefit from it.
Absolutely. Dr. German, you're a huge proponent of using, as you mentioned, food, also vitamins. And we got into a discussion before the show began tonight about vitamin D and its importance. And I'd like you to talk more about that.
I think here majority of population is deficient in vitamin D because we live so much up north. Vitamin D is a simple measure, and it prevents a variety of problems. Asthma in children, there have been studies that show that they are more at risk for asthma if their vitamin D is low. It boosts the immune system, it prevents depression, or it helps for depression, chronic fatigue, also prevents different type of cancers, including breast cancers, prostate cancer. It could be also involved in multiple sclerosis. So I think we should all have some vitamin D.
How much do we take? There's a lot of discussion about that, and especially for children.
It depends. I think depends on the age. It is recommended that infants, especially if they are breastfed, should have at least 400 units, international units. I think adults should have at least 2,000 units. If not 5,000 units. You can also check a vitamin D level and make sure you are not doing too much, depending on how much you're staying in the sun. But if you are using sunscreen, you are not going to make enough vitamin D.
So getting a blood test might be a good idea?
Yes. Yes, getting a blood test, or maybe start to take and then check your vitamin D to make sure you're not taking too much.
What are the risks if I do take too much?
Vitamin D is liposoluble, so it's not so easily excreted by the body. So if you take too much, a level of above 150 is considered toxic. Usually, and the level of, in functional medicine, we like to see a vitamin D level around between 40 and 60. And in conventional medicine, 30 milligrams, it's considered normal. But there is a big gap between this 40 and 60 to 150.
There certainly
is.
It's
very difficult to achieve that toxicity.
Okay. We have an email this evening that we want to address. And Dr. Langenderfer, I think this is probably going toward you. Will acupuncture work for arthritis pain? And this is coming from Bob here in Spokane.
Absolutely. I think acupuncture excels at arthritis and chronic pain conditions. That's why people associate acupuncture so much with using it for pain.
So that's something that Bob should probably seek out and get more information about. Excellent.
Absolutely.
And another phone call on the show tonight. Leon from Spokane Valley. Good evening.
Hello. I have two questions. First, the vitamin D you talked about, but what is a normal level? If your vitamin D was 37, toxic is 150, where should it be? That's one question. The other thing is the omega-3s that are sold, you know, in drugstores and here and there. I got one, and I started taking it. I got feeling bad, and so I broke one of them open and tasted it, and it was rancid. And I was wondering, on pills that are oil, should we open them up and make sure they're not rancid, even though they're not outdated? Because that really scared me. And as soon as I quit taking it, after about a month, I felt better. But I believe I was poisoning myself from it. And the other thing I wanted to ask is if anybody has had any experience with carbon dioxide poisoning and how to detox from that. My level was 337 parts per million in my home for almost a year before it was discovered. And so I was toxic for about 2.5 years, but I wondered if there was anything that you should be taking to detox from carbon dioxide. And so anyhow, and then the other thing I was going to ask, on elderly people, how much vitamin D would be, 5,000 a day? Is that what I heard her say? And that's kind of my questions.
All right, we'll try to get to all of those. Thanks for your call tonight. Let's start with the vitamin D issue again.
So vitamin D, again, we like the level between 40 and 60. So your level of 37 is pretty close. The other question regarding the omega-3s, a lot of the supplements that we take need to be good quality. Omega-3 is one that it's very important to have a good brand. You want to make sure that it says that it's mercury-free certified. A lot of good companies have a third party to check the quality of their supplements. There is a site called Consumer Lab that checks for quality of supplements. The omega-3, it's good to spend the money and get a good brand like Nordic Naturals, Carson. There are a lot of companies out
And look
there.
for that consumer label.
The third party. So there is a third party usually that checks for quality.
Okay. And are either of you familiar with how to detox the body with the carbon monoxide poisoning? What a method might be for that?
I always think about general liver support and using herbs that help the liver with detoxification. So that would be one of my first thoughts with that.
Is it something she should see a holistic doctor or naturopath about to know what the levels are in her body?
I think it would be the levels, but also important to be working with a doctor that does natural medicine, because when you detox the body, there's a right way to do it and a wrong way to do it. And if you start going too fast, the person can actually get much more sick than what they were to start with. And so if you're working with a practitioner that has experience with this, they would be able to help guide you through that, so that way you're not making yourself more sick in the process.
Excellent advice. Another phone call coming in. Tom from Spokane. Good evening, Tom.
Good evening.
You have a question?
Yes, I was wondering if an individual has had long-term depression. I had a heart attack, it got worse. What can one do for that through the holistic medicine? I'm from Portland, Oregon, and I've tried it in the past and have had marginal success.
Tom, did you have depression before your heart attack, or was it
Yeah, I
simply after?
did, but it was low grade, and they were able to treat it with a pill. I had the medication given to me after the heart attack, and then it became quite acute for about 4 years until I went back and they did something about it and took me off the medications.
Okay, well, Dr. Langenderfer, are you familiar with how depression can be treated with natural medicine?
Yes, there's a variety of methods for treating depression, and I always think the key is trying to figure out why the person has depression to begin with, and trying to figure out what that root cause is. And sometimes, going back to diet can make a huge difference with depression and how somebody feels. The gut's looked at like a second brain, and if you have a lot of inflammation happening in there, it's going to be causing that in your body in general. And so I kind of always start with the diet with people, and then do some other lab testing to try to figure out and pinpoint where some other issues may be happening.
And Jane, I'd also like your comments on this too, because I think this comes into play also.
It does. In fact, the Scripps down in California, their cardiology department prescribes mindfulness for all of their cardiac patients.
Because this is not uncommon.
Because it's not uncommon. And mindfulness gives a person some tools to be more aware of their own thought processes. And depression isn't something that is totally out of the reach of self-care. There's a lot that can be done if the right methods are taught for helping to be more refreshed, more positive, be mindful of the beauty and of nature around you and of your own body, and mindful of what is happening in your body when the depressive thoughts intrude.
And recognizing those.
And having the tools then to work with yourself and know when to get help beyond the mindfulness. So it's actually a prescription that the doctors write and insist that their patients use. We're looking at having some of it, some mindfulness exercises on closed-circuit TV for our cardiac patients.
That's an excellent idea.
I would like to add that Dr. Mimi Guarnieri, who is the cardiologist scripts, she used to put a lot of stents in the past, but now she uses heart math, which is a neurobiofeedback computer system that teaches you mindfulness and gets you into the practice of doing it every day.
Every day. Yeah.
Are you finding that we are getting back to some of these older practices and looking at food and vitamins and how the mind works and faith rather than just prescribing a pill? Is this sort of coming full circle?
Absolutely. I really think it is, because people want to fix things. They want to figure out the why, not just simply mask it.
Don't just give me a pill and call me good.
Right.
Yeah, it is very interesting, and a lot of people exploring these options again. And we have plenty of phone calls and emails this evening. Excuse me. Let's go to Carol in Grand Coulee. Good evening, Carol.
Good evening. I have a question about dietary changes for ulcerative colitis. And I was also wondering if there was any recommendations for diet to reduce stress.
Dr. German?
So for ulcerative colitis, is an autoimmune disease, and we do an elimination diet, but I would recommend gluten-free and dairy-free. You can have very good results with ulcerative colitis using a functional medicine protocol. And also adding probiotics. There have been studies that show that VSL number 3, which is a high potency probiotic, has been used successfully in patients who have ulcerative colitis. And of course, stress is very important. The mind and the body is related. The brain and the gut are related both ways. So if we are in a stress state, we are under the fight and flight response, and that's when we have difficulty digesting right. So the stress needs to be addressed. It's an important part of the treatment.
Okay. And an email to address this evening from George, who says the application of pulsed electromagnetic force to increase microcirculation is a field of therapy popular in Europe and over 50 other countries. When will the North American alternative medicine community fully embrace this? First of all, explain what this is, and then if either of you know what George is talking about.
I know that there are different devices used. There is one here in Spokane that's been quite popular. It's called Beamer. It comes from Germany or Switzerland, and it stimulates, the idea is that it stimulates the circulation and the microcirculation. If you have more blood flow to the tissues, you will supply more oxygen, and you will be able to help heal and fight inflammation and oxidative stress, which are the seeds of disease.
So it has indeed already made its way to North America. It's just seeking it out and finding out more information. Excellent. Dr. Langenderfer, I also want to talk to you about a practice that we've sort of been hearing more about among the celebrity population, and that's cupping. Explain what that is. And we've often seen some of the celebrities with these marks on their back, and it's becoming more popular. What does it do?
So cupping is used quite a bit actually for pain, but you can actually use it for other things like asthma, or if somebody has a cold or flu. It can help the body with detoxification. But essentially what we're doing is we're putting some glass cups on the back, and it creates the suction. And by creating that suction, it's helping to increase circulation into that area. And usually what I see is that the more tension there is in an area, the darker the marks are, which essentially can look sometimes pretty black and blue, or it looks like a hickey on the back, and then it goes away usually within a few days or a week. And the more often the person has cupping done, they will get to a point where they won't have hardly any marks from it at all, because we'll have gotten all that circulation moved throughout the body.
Does it work then sort of similar to how acupuncture works? Finding those areas?
I would say it's a little different than acupuncture, because we're not necessarily always going over an acupuncture point. We're going over areas where there might be muscle tension and pain. And if I were to use it over an area that was an acupuncture point, maybe if somebody was having an asthma issue, there are some points on the back specifically for that you can put the cups over to help with that as well.
And so that's how you know where to place the cups. And how long would I have the cups on?
It depends. So if somebody's doing it for the first time, I don't leave them on very long, maybe a couple minutes. And then if they've had it done a couple times, I might leave them on for 10 to 15 15 minutes. But if somebody has a lot of pain and tension in an area, they can get actually quite sore from the cupping. And so you have to sort of ease the person into it and see what their tolerance level is. But it can definitely make a huge impact for pain issues.
Generally, how many treatments does it take to sort of get to the point where you're not suffering anymore?
Well, when I do cupping, I do it in conjunction with acupuncture, so I'm always doing them together. And it really depends on what the person has happening. So if it's an acute situation where maybe they just hurt themselves, maybe after 4 or 5 treatments, there won't be any pain left. But if they've been having something going on for years and years, it's going to take quite a few treatments to help with that.
All right. We have another phone call from Valerie in Joseph, Oregon. Good evening, Valerie.
Well, good evening to you.
Thank you for calling. What's your question?
Well, I have 2 subjects. The first one, which has to do with the accessibility financially for low-income people who are on Medicare and Medicaid, which they do not recognize, but we've made improvements over the years, haven't we? The value of seeing a naturopathic practitioner, and the reason is for me to be so frustrated is I have hypertension and blood pressure 240 over something, and I am not willing to risk the side effects of the conventional blood pressure medication, and am currently on 0 medication at all. So I want to understand if there's any information you can impart. What does the person do to lower their own blood pressure? And I'm thinking hyssop. And I know walking and diet and positive attitude got those. What would you say?
All right, Valerie, thank you so much for your call. And Valerie's certainly not alone. We're a nation of people with a lot of high blood pressure issues, and she's taking the proactive approach by wanting to not be treated with standard drugs. So what can she do?
So for high blood pressure, there are some simple things that you can start with herbally that can have a big impact, one of them being hawthorn. And hawthorn is a great herb. It was traditionally used and made jam out of it. So it's a very safe herb and has been used for a very long time. And one of the other things I like to start with too is magnesium, because magnesium, most people are deficient in magnesium, and magnesium can help with so many different things that you can, I'll have people use it to help with sleep, you can use it for high blood pressure, you can use it to help the hormones, so it has a lot of positive impact on the body.
She also expressed some frustration in the fact that Medicare, Medicaid, she was having some difficulty finding care, being low income. But this is becoming better, but we're not quite there yet.
And part of that too depends on what state you're in, and some of the laws are a little bit different, and some, for example, in the state of Washington, they are starting to recognize naturopaths, the Medicaid is, but it's very new, so they don't have a lot of providers yet participating in it. So that's something that you will see change, and I know that they're looking at Medicare as well, and that may be years down the road. But I think that with anything, the drive is going to be people wanting this type of medicine.
And she should talk to a practitioner. Maybe they'll work with her, on that budget or a payment plan. It's always worth a try.
Right.
Get in there and give it a shot. All right, we've got Rita with an email this evening. Are there natural approaches for vaginal dryness related to menopause? And Dr. Langenderfer, you treat a lot of women. Is this something you see?
Yes, I see this actually quite a bit and quite often. I do a lot of bioidentical hormone therapy, and so for a lot of women I will use a bioidentical hormone to help with that. And sometimes just doing some simple things like increasing flax oil in the diet can be helpful as well, because flax oil contains some phytoestrogens. So it depends on the severity of it, but there are a variety of ways to help improve that.
All right, and another phone call. We're getting right to them tonight. Holly from Colville. Good evening, Holly.
Good evening. Do any of your panelists have any recommendations for nerve pain, particularly like peripheral neuropathy or pudendal nerve pain? And I'll be watching for their responses, and I thank you.
Thank you, Holly, very much for your question this evening. Dr. German?
Again, the question is where is the neuropathy coming from?
This is something you like to start with the source of the problem.
Right, yes.
Which makes perfect sense.
So in general, we do a very thorough evaluation, see if there are any other symptoms associated, if there are any nutritional deficiencies, if gluten has been associated with neuropathy, so an elimination diet would be very helpful. Homeopathically, there is hypericum that has been used for neuropathic pain. It usually works better in acute situations, but you can try it, it's not going to hurt. Again, it has to be a thorough evaluation, and I would start also with a gluten-free diet for a few months and see if that would help.
It could be a contributor.
It has been associated with neuropathic or neurodegeneration, yes.
And something, Jane, I want to talk to you about something that goes on at the center called palliative care.
Yes.
Talk about what that is. Is it's similar to hospice care?
Well, it's similar but not the same. Palliative care can be used in conjunction with traditional medicine and people who don't have a life-threatening illness. It's treating the symptoms. So in many ways, what you do would be considered palliative care as well. In some ways, it doesn't try to cure necessarily. The intention is not to cure an illness, but to treat the symptoms and relieve the suffering. Palliative care is done in conjunction, again, with mind, body, spirit together. It's also extremely relational. So a team of people work with a patient and the family system, because frequently distress is from families pulling in different directions. So getting everybody to work together in the family, finding what are the goals of care, and determining what is in the patient's best interest, what will relieve suffering most. And you know, for some people, it's being treated traditionally until a person dies, and for others, it's going on hospice. And for people with chronic illnesses, it's often finding ways to just relieve the chronic suffering and the debility that goes along with chronic suffering.
So would it be a series of visits, or is it just simply an ongoing process?
It's an ongoing process. It depends on the situation. Palliative care would like to move upstream of acute care, but unfortunately, like chaplains, we come in at the end often. So palliative care is often the step in acute practices. The palliative care service comes in at when traditional medicine determines that they don't have a cure or there is no further cure, then palliative care comes in. And what's interesting is that once you make people peaceful and you find out what's underneath their distress,
again, beginning at the core,
going
the core of the problem,
and frequently all of the things we've talked about often have an existential or a spiritual or an emotional undercurrent as well. So finding what those are and dealing with those is frequently very freeing for people. So we'd like to do it with you.
Work in conjunction.
Yes.
Yeah, absolutely.
Because we don't have neat little boxes inside of us that says this is my mind box and this is my body box and this is my spirit box.
Absolutely. Absolutely. Let's talk to Sharon from Stony Plain, Alberta. Good evening.
Hi.
Hi, Sharon. What's your question?
Thanks for taking my call. I've had tinnitus for about 4 years as a result of a fall, and I'm looking for, there are times when the ringing in the ears is very moderate and tolerable, and there's other times that it's absolutely excruciating. And I'm wondering if there's anything that's out there that can be done for it naturopathic. And I sometimes wonder if it isn't weather related. Is that possible?
Do you find it triggering at certain times?
Yeah, I do. But it's not consistent.
Okay.
I think that she had mentioned that there was a fall, so if there's some damage that has been done to the ear, that's where I think about things like acupuncture and herbal medicine, trying to help to restore that. And if it's been going on for a long period of time, it may take longer to see results from that, because the longer something has been happening and the longer you've had a disease, it's not going to go away necessarily overnight. And so it may be doing different treatments like that and being consistent with it for a period of time.
So probably not something that could be treated with food or herbs or something like that, because it's more of a chronic pain issue?
Well, like, it sounded to me like it might have been an injury issue. Yeah, so I'm not sure if it's necessarily diet, because it sounded like an injury had happened.
Okay, absolutely.
Diet can, was an article published by Dr. Amen, A-M-E-N, about healing brain injury and he has been talking about diet and lifestyle. So that's definitely going to help, but there might be some additional treatments necessary.
We want to talk a little bit about a chiropractic method. Physical therapy, of course, and chiropractic care have been around for many, many years, if not hundreds or thousands of years also. Massage also comes into play. But new to the mix is something called ART. It's active release techniques. To say that art is a little of all three doesn't really do it justice. So we spent some time with someone who has used this to find out more about chronic pain. Tierney Bagley is an active college student, but until recently, a jog around campus was painful.
I was in pain all the time, and I could only do certain things without my back just completely tightening up on me and hurting really bad.
2.5 years ago, Tierney was in a car wreck that fractured bones in her back. She tried all kinds of things to stop the pain, but nothing brought the relief she was looking for. Active release was the last resort.
It was kind of a one more thing, but it was also last hope.
It worked.
I barely feel it anymore.
Tierney says ART made all the difference, and she credits Chris Gradaville at Spokane Chiropractic and Sports Injury Clinic for putting an end to her pain.
It used to be the first thing, like when I would get out of bed, it would hurt to get out of bed, and now I can go all day without thinking about my back hurting.
Active release therapies work to restore range of motion and release trapped nerves.
The muscle releases, and sometimes, yes, the pain will go away immediately.
ART got its start with athletes, but Chris has all kinds of clients.
I see all ages and types of patients, anywhere from ages, I think my youngest is 10 to 85 right now.
Some have injuries from sports and others from accidents. Most find Chris after other options have failed.
It's fairly new. They go to everything they've heard of first.
Sessions are short. Most run 15 to 20 minutes. They're targeted and they do hurt.
You doing okay? Mm-hmm. It comes with a little bit of pain as well, because you're disrupting tissue.
A little pain for a whole lot of gain.
It's insane being able to go through the day and not having my back hurt anymore. Now,
we do not have an expert on the panel to address exactly what this is, but it just so happens that Dr. German has actually had this treatment. Talk a little bit about it. We saw some of the practice there on the young woman, and he mentions that it is painful.
It is painful. From my understanding, it works on the fascia. Fascia is the tissue that covers the muscles, and a lot of times if there is a scar at the fascia due to a trauma or overuse, this technique stimulates the blood flow to that scar and helps resolve the scar.
So they really have to move things around.
But it is painful, yes.
May I ask what you were treated for?
Leg pain.
And did you find relief
after
going through the treatment?
Yes.
It's very interesting, and another alternative practice that we wanted to explore this evening. Let's go to the phones with Jeanette from Moose Jaw. Good evening, Jeanette.
Hi there.
Hi.
In regards, there was a lady that was talking about her high blood pressure, and you suggest hawthorn or magnesium. Now, I've been on Coversol 2 milligrams for about 6 years. And how much would you recommend of the hawthorn and the magnesium, or do I have to see my own physician about that?
I would see your physician about that, because if you're, depending on how high your blood pressure is, you don't necessarily just want to stop taking that and take the other, or vice versa. You don't necessarily want to add those things in with the medication because it may drop it too fast. And that can certainly happen, and people would feel dizzy, lightheaded if their blood pressure drops too low. So you want to be working with somebody before you do that.
Okay. Very good. And another email this evening to address: to find the source of my ongoing upper abdominal pain. I was told that a colonoscopy is needed. I'm concerned that this is overkill, so I've decided to change my diet to gluten-free before proceeding with this procedure. Is this a reasonable idea?
I think it is. I would do more than gluten-free. I would suggest doing an elimination diet for at least a month, eliminating gluten and dairy, and also looking into adding probiotics and omega-3s.
And elimination diets have become quite popular also to determine different ailments. And basically you're just starting with the process of either eliminating wheat products or dairy products, and if that doesn't seem to work, then do you move on to something else?
So in functional medicine we have this protocol that we eliminate the 10 most allergenic foods, which are dairy, gluten, also soy, corn. So there is oranges or orange juice, and we stay off this for a month. And after a month, we reintroduce one food at a time for 3 days. And a lot of times you will see reactions then. For example, I have patients who come with pain. Pain gets better, but when they reintroduce dairy or gluten, the pain comes back. So then you are able to know how your body reacts to these foods and save some money, and also the food allergy testing can be it's not all the time reliable. So I know a lot of patients would like food allergies, but I think the elimination diet is much better than that.
Okay. Another phone call. Marion in Spokane Valley. Good evening, Marion.
Good evening. I just have a question. You had a lady call in about her hearing or the tinnitus in her ears. And I was curious on vitamin A. I know an elderly lady that she started taking vitamin A, and she would hear the whooshing sound, and it just drove her crazy. And the vitamin A seemed to relieve that, and so that she didn't have, she wouldn't complain about it as much. So I'm curious on what their take is on vitamin A, and I'll listen to you off the phone.
All right. Thank you so much, Marion. Vitamin A.
Vitamin A actually is a strong antiviral. You can use it acutely for people when they start to get sick, and my guess would be is that there might be some type of viral component to what was triggering her condition, and that's why she's finding it helpful, and it's a great immune booster.
A lot of people will go on the internet and research these topics and look into things, and we've often talked on this program about how the internet can be our friend and our foe. Do you have some suggested sites that if people want to learn more about using vitamins and using herbs and food to better treat their bodies, or do you suggest they simply see a practitioner?
I think seeing a practitioner is the best, because you can modify it specifically for what that person has going on, and you're going to get large reference ranges over the internet, but it may not necessarily apply to that person. And sometimes, like vitamin A is a really good example, you may find some of the treatments for it for a viral condition to be very high dosages, maybe even in the 100,000s, where if you go above 25 it can be toxic. And so you can use these high dosages acutely, but you definitely would not stay in something like that long term. And so you want to be working with someone that understands that you only do that for a short period of time.
And to look at this as if we're looking at, any kind of drugs or supplements we're putting into our body, we need that expert advice.
Yes, and there have been cases of vitamin A toxicity that can create cerebral edema, and So all these measures, all these natural supplements, they act in the body like they changed our biochemistry. So they all have to be done in a certain way at a certain time and individualized to the patient. The medicine that we practice is patient-centered, it's individualized, it's not disease-centered. So we don't look so much at the disease, we look at the patient and the individual.
Okay. Joe from Coeur d'Alene with a phone call. Good evening, Joe.
Hi.
You have a question for the panel?
Yes, I've been diagnosed with vertigo, actually benign paroxysmal postural vertigo. I've been dizzy like for about a month and a half. I've noticed I've been dizzy and nauseated, and so I'm wondering if they have any particular recommendations for the vertigo and being dizzy off and on. Thank you.
Thank you, Joe.
One of the things I think about is inflammation, and inflammation is being a trigger for that. And then acupuncture actually can be a really great treatment modality for that, especially since it's just a current onset and can provide quite a bit of relief for patients.
Yeah, because it can be quite debilitating.
Mm-hmm.
It can absolutely, it can absolutely be debilitating. So as we, talk more about these methods, and of course I'm fascinated by the topic. Again, not using the internet as our sole source. How do I take that first step? Can I just call, or do I need a recommendation from my primary doctor? Can I just simply make an appointment with one of you to, seek help?
Yes, you can.
I can do that?
You can. You can pick up the phone and call, absolutely.
Mm-hmm. And are people still hesitant to do that?
I would say not as much. Definitely, I would say, when I first got into practice 10, 12 years ago, things were still new and people not sure about what, naturopathic medicine is or acupuncture. But there has been so much change and so much good change and just more information out there with just TV, the functional medicine piece of it, and people becoming more and more aware of that it's almost becoming second nature, and it's been just great to see that.
Are there still misconceptions about what you do?
I think it's very hard to understand how powerful this medicine is. I didn't understand initially. I was very interested when I was in training, but then when I saw the results, it's amazing. Of course, everybody has their own journey, and there is a physician who comes to the functional medicine conferences, Dr. Terry Walls. She has her story on minding my mitochondria. She wrote a book about. She was diagnosed with multiple sclerosis, took a lot of medications, ended up in a wheelchair, and she started to change her diet, and she was able to bike. She's working with NIH, funding a clinical trial. So multiple sclerosis can be healed with diet. Everything, disease can be reversed.
All right, so interesting. Dave with a phone call this evening from Spokane. Hi, Dave.
Hi.
You have a question?
They talk about the body electric, and you have a program coming on 7.2 at 8 o'clock, and it's about the magnetic field around the Earth. And the reason I brought this up is because there was a question earlier from the woman with tinnitus about the weather and issues like that, and it does affect the body very much. There's a new field now, hyperbarics, and it's coming on strong. I'd like your guest to address that. And then, too, there's more thinking now that the body illness is based pretty much on inflammation in the body and addressing the inflammation. There's I don't know if it's a herb or a seasoning called turmeric, curcumin, that's showing great promise in the medical field. Could you address that?
All right, Dave, thank you so much. Let's talk about the atmosphere question, weather, and just our surroundings. How much can that affect our health?
I think it greatly impacts our health and has a significant effect. And I think he was talking maybe about the hyperbaric oxygen chamber, which I am not an expert in, but I do have quite a few patients that have had that therapy and have found it quite helpful.
And we have a center here in Spokane Valley, with a hyperbaric chamber also. So, and Dr. German, your comments?
I would like to talk about turmeric.
Yes.
So we do agree there is a consensus that the seed of disease is inflammation. If you have any any problems, you have inflammation in your body, and that has to be addressed, and has to be addressed again as a whole, starting from the diet, lifestyle, supplements. Turmeric has been very beneficial fighting inflammation, but I don't think that just taking turmeric will be enough, but it was, there are a lot of studies that suggest that's very beneficial.
And how much, again, on something like that do you recommend? Or is that something, again, you need to consult with an expert?
I think it depends. You can also take it in food, if you like Indian food, make curries.
Does it come in pill form?
It does, yes. I don't know the dose by heart.
Okay, again, something to consult with an expert like yourselves. We are getting short on time, so I guess I'd like some final thoughts, and we've touched on any number of topics under the umbrella of alternative and complementary medicine tonight, but really let's talk about some final thoughts when it comes to what you do and what you'd like to see, how you'd like to see people address their health issues.
I would like, it would be wonderful if we could all understand the impact of diet, our lifestyle, and our health. There has been a lot of very interesting studies demonstrating that we can change our gene expression with foods. And I, as a pediatrician, I'm very concerned with the health of our children. This is the first generation that has a lower expectancy life than their parents. So looking at the diet for our children, looking at the diet of a pregnant mom, a woman, it's very important for our future generation.
All right, Dr. Langenderfer.
I go along with the same thing. My thought is always coming back to the diet, and really my emphasis to people is eat real whole food and things that aren't packaged, and really getting people back to finding things locally, trying to find their meat locally, getting grass-fed beef. It has a different nutritional makeup than corn-fed beef. So some of these simple changes can have a huge impact, and getting people to understand we've been taught that beef is bad. It's not necessarily bad, it's what we've done to our meat. So getting real good quality whole foods.
And Jane?
And I would say ditto to all of the above, except that I think we consume more than food. And so I would encourage people to look more holistically at how we spend, how we consume, how we eat, what we take in, and what we give out. You talked about detoxifying, and I think we can detoxify emotionally, spiritually, and mentally as well as physically, and I think it's important to do them together. If you clean out the body systems but are always angry and frustrated and unhappy, then you've only done part of the work. So I would encourage people to think in terms of a healthy spirit as well as a healthy mind and a healthy body.
Well, thank you so much. Very good advice tonight and a great discussion. I certainly appreciate this evening's show. Thank you again. And that will do it for this edition of Health Matters. Our very special thanks to everyone who called in or sent their emails, texts, or tweets with a question. A big thank you as well to our panel for being here and sharing their expertise. I'm Teresa Lukens, and for all of us at KSPS, good evening.
Health Matters is made possible by viewers like you, the friends of KSPS, and by the following.
As the saying goes, children aren't just short adults. They have special needs. I'm Dr. Judy Felgenhauer. I chose Providence because they see the need for specialized care just for children.
Find your doctor online at phc.org.
Providence has the best professional and the best nursing staff, without which we could not do these complex procedures. I'm Dr. Stephen Nisko, and I choose Providence because Providence is fully invested in my success and in the success of my patients.
Washington State University Spokane, studying the feasibility of a state-funded medical school on the WSU Spokane Health Sciences campus. More at medicine.wsu.edu.